This is the Medical Minutes Podcast on the All Indiana Podcast Network. Your source for the latest news, updates, information, and more from the world of health and medicine. Now, here's Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. Taking antidepressants during pregnancy has been a concern for many expectant mothers, but a growing body of research points to evidence that it's not the antidepressants that will harm newborns. It's when mothers neglect treatment for depression that can put their babies at risk for seizures and epilepsy. I spoke with Kelsey Wiggs, PhD candidate at IU Bloomington and specialist in this field of research, who explains. Our conversation is next. Kelsey, tell me a little bit about this study and what did you find?
So what we found was that when we studied women who took antidepressants in pregnancy and their children, we saw that basically they were at higher risk compared to children that were not exposed to these medications in pregnancy for things like neonatal seizures and epilepsy in childhood. But we found that that risk was likely due to things like the underlying condition, depression, and just sociodemographic characteristics that differ between women who do and don't take these medications.
So if a woman is depressed and not taking her medication, if I'm understanding correctly, would the child be more likely to have a seizure? I'm not sure if I heard that right. Instead of the other way around, the woman stayed on her medication, and we saw no sort of, at least, I don't want to say causal, but link between the seizures.
Yeah, so there is research to suggest, not this work directly, but there is research to suggest that untreated depression does pose risk to children as far as that prenatal exposure, but we're not exactly sure why. It could be for genetic reasons, right? Because depression and epilepsy and seizures do kind of have shared genetic risk, and it could be related to the depressive symptoms themselves, which could then suggest, in that case, that treating the depression would be the best thing to do to actually mitigate that risk.
Wow, because I understand that a lot of women might be concerned to be taking their antidepressants during pregnancy for a certain risk of whatever risk that might arise in different literature or this literature. But so are we talking about neonatal seizures and then in childhood, the likelihood of having seizures or epilepsy? Are we talking about both? So either
both. Yep. So what we did was we looked at the two outcomes separately. Neonatal seizures, meaning seizures in the first 30 days of life. But then we also wanted to understand the longer term potential consequences. So we did follow children for at least 2 years of their life, and some of those kids even longer, to understand if there was risk for developing epilepsy as well, which is actually 2 or more unprovoked seizures in order to get an epilepsy diagnosis.
And then there's also evidence that, there's always sort of an equal and opposite study, right, that we have in science, just the way it works. So what is the evidence out there that contradicts the results of your study? What's out there that says this may be actually a thing?
Yeah, so a lot of work has been done, especially on those neonatal seizures. So the hypothesis that we were really or the mechanistic hypothesis that was kind of at play here was that, especially later on in pregnancy, there's been lots of research to suggest that when you take that medication in maybe your third trimester, especially of pregnancy, once the child is born, there are these withdrawal symptoms that they go through, which could then also mean a neonatal seizure, among other different withdrawal symptoms. And that has been documented in the literature. And it's totally possible, for instance, that for some children, that might still be the case, right? So higher doses of these medications. And also, even in those studies, though, it could be that even though we're seeing that, it's not necessarily for the reason of the medication. It could be that, just like we found, it's for other reasons. So it's really unclear how to reconcile some of those differences.
And Kelsey, what is your advice to expectant mothers, women planning to become pregnant?
Yeah, I would say pregnancy is a really hard time, right? And I think you're, just as you were alluding to earlier, there's so much weight given to taking a medication or not. And oftentimes we really think to ourselves that there's going to be more likely to be consequences for taking a particular medication on the risk for our children. But really what this study is suggesting is that we really need to kind of take a step back and think about all the pros and cons of taking a medication or not only for our own health, right? Because untreated depression is no fun for anybody, especially when you're pregnant, but then also it may not be as clear cut as a medication inherently being harmful to our children either. So that'd be my advice, is kind of weigh all the pros and cons with your medical providers.
Right. So it's sort of you have to understand the risks of depression when you are carrying a child. And there is this hypothesis that it could be the depression that might be leading to these things. And of course, we don't know yet, but the untreated depression is maybe more of a problem than we might think.
Yeah, potentially. I think it's, unfortunately, there's so much we don't know, but hopefully this study can provide a little bit of reassurance that it really is, at least for these outcomes and a growing body of literature for other outcomes in children as well, that these medications may be safer than what we maybe thought to use in pregnancy.
Mm-hmm. Well, Kelsey, thank you so much. Congratulations on finishing your work. I've done the path. I know what it's like. It's not for everyone. So making it through, that's awesome. All right. Well,
thank you so much.
Yeah, you take care. This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
This is the Medical Minutes Podcast with Wish TV's Dr. Mary Gillis. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast, and discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.